Okay, so to start our discussion on the systemic conditions, again, this is going to be kind of going through some various body systems. So again, make sure you kind of have a little bit of awareness of the background of the function of some of the others. We spent pretty much the whole time in class basically talking just about the lymphatic system and its role in the immune response. And we'll start out talking about some conditions that involve that. But again, we're going to go through some other systems. So make sure that you, again, connect, the systems with the conditions as you're kind of going through. So to begin the discussion, we're going to talk about some conditions involving the lymphatic system. Non-Hodgkin's lymphoma is a group of malignancies that affects the lymphoreticulaire system. This form of lymphoma typically happens at a slightly older age, so it usually does not affect adolescents. There are several different types and different classifications. I would just be aware of the general signs and symptoms, and as far as what common areas that are affected by non-Hodgkin's lymphoma. So we have the most common sites where this typically occurs, usually in the abdomen, the mediastinum, which is the area in between the chest where the heart is, and the neck. Here's just some table that's in your textbook that looks at staging for lymphomas. Again, it's just kind of showing you how different lymph nodes can be affected. And again, the biggest thing with cancer is the metastasis, meaning, and when you talk about cancer metastasis, it's when the cancer moves to other regions of the body. Hodgkin's lymphoma, so we have non-Hodgkin's lymphoma and we have Hodgkin's lymphoma. This is another malignant condition. It's different from non-Hodgkin's because of the existence of what are called Reed-Sternberg cells, which are multinucleated giant cells. Now this one, the incidence of this does increase throughout childhood and into late teenage years. Typically it peaks from ages 15 to 34, and then again after age 50 it becomes a little more common. Hodgkin's lymphoma is a little easier to treat. The prognosis tends to be a little better for Hodgkin's lymphoma, again because of the different cellular makeup of this particular form of lymphoma. And here are some common sites to Hodgkin's lymphoma. So again, if you look at where, again, it's cancer of the lymphatic system. So again, commonly a lot of times the initial response will be the enlarged lymph node, then with kind of some of the other signs and symptoms that as you read through your text will come along as well. So again, note, just like you would with anything else, what those common signs and symptoms are. Hodgkin's lymphoma, if caught early, is fairly easy to treat, as it typically has a much better outcome than the non-Hodgkin's forms of lymphoma. Leukemia. Several different types of leukemia. So leukemia is basically cancer of the white blood cells, and what it involves is basically a proliferation or an uncontrolled growth of white blood cells in the bone marrow. And what happens is those white blood cells basically then accumulate and replace all of the normal blood cells in the bone marrow. This can spread to other parts of the body, so it can metastasize like all forms of cancer. The common areas where it could spread to are the lymph nodes, liver, spleen, gonads, the kidneys. Even the central nervous system could be affected as well. And again, the one thing to always remember is even when a cancer metastasizes or spreads, it's still kind of treated as that particular cancer, meaning leukemia is still leukemia. It doesn't become a different type of cancer just because it metastasizes somewhere else. So that's what you would have with leukemia. Again, there are several different types, and this primarily affects the white blood cells. Okay, vector-borne disease. So these are types of diseases that are carried by an infected organism, very commonly a biting insect. So again, ticks and mosquitoes are very common, and that gets transmitted to a healthy person. So this group of diseases is largely preventable. It's just basically avoiding whatever the actual vector is that would spread it. So we're going to talk about a couple different conditions that are very common and discuss some of the issues related to them. So Lyme disease, this is the most common tick-borne illness in the United States. This is a multi-system disorder. So this is something that can affect various areas in the body. So they can affect the musculoskeletal system through the development of arthritis at the joints. It could form neurological symptoms. So that this could progress throughout the body and become a pretty debilitating thing if not caught early. So the point in this is there's some specific early symptoms that you should look at. However, one of the more common things that we think of being the kind of hallmark sign, and I'm not saying it particular because I want you to be able to see it in your book, but the classic early sign of this sometimes is not present, and people then tend to neglect their other symptoms that may come about. The other thing is obviously ticks can be very hard to see, so it'd be important, particularly when you go out in areas where there could be a lot of ticks, that you, again, make sure that you check yourself and that you know proper removal of the tick. And these are just the top 10 states to report Lyme disease. If you notice, Pennsylvania is actually at the top of the list. So again, be thinking about, the other thing is consider where you're working in some instances like this. So if there's a high incidence of a condition in the state that you're working in and you suspect that there could be a problem, it would be really important to just kind of note that could be on your differential diagnosis. Okay, Raynaud's disease. So this is a disorder characterized by vasospasm of the arteries. You usually see this in the hands, but it can affect other areas of the body as well. The primary condition is known as Raynaud's disease if there's no other cause beyond the vasospasm. So depending upon whether you have this being caused by something that there rather is no cause, or if there is a secondary condition causing this. So there's basically primary and secondary versions of Raynaud's. So if someone were to kind of develop this, you would want to try to find out if they potentially have another condition that could be causing it to happen. However, many people also just they get Raynaud's for no apparent reason. So if there's no other cause beyond the vasospasm, it's just then referred to as Raynaud's disease. So here's a picture of Raynaud's. So what basically happens with Raynaud's, and this usually happens when you're looking at temperature changes. So if someone is outside in the cold and then all of a sudden they come indoors, this is something that you would see right here. So you see the blanching of the skin. So usually there's what they call a triphasic color response. So it starts out as where the skin becomes pale, like you see here, you get the pallor. So what's happening here is you're getting the vasospasm and the blood flow is basically being restricted to the area. Then the skin will gradually become blue because of the increase in the venous or deoxygenated blood in the digits. And then gradually it will turn red, go into erythema when the vasospasm resolves, and then there's a rush of blood flow to the finger. And this could also cause like some pain and discomfort as well once all of a sudden now the blood kind of rushes back into the body. So when you look at when you're looking at the referral and diagnostic tests, so there's no blood test per se that assists with the diagnosis of this, but usually what they'll do is they will order some other tests that look at other systems just to kind of see if there's something else that would be causing this in the individual. And basically once everything else is excluded, then they basically diagnose it as a primary Raynaud's, and that would be what your final diagnosis would be. All right, systemic lupus erythematosus. or commonly just referred to as lupus, is a chronic autoimmune disorder that affects many different systems throughout the body. So when you look at a lot of the signs and symptoms of this, many of the systems that are affected here will usually present with issues. And it's an autoimmune disorder. So remember, the immune system is what basically attacks whenever we have a foreign pathogen in the body, a bacterial, a viral infection. The immune system basically goes to work to kind of attack that foreign pathogen. In an autoimmune disorder, what happens is the body attacks itself. So, and in a case like this, attacks many of the various systems throughout the body. There tends to be, when someone ends up getting diagnosed with this, there tends to be exacerbation and remission periods. So where they'll be more symptomatic, and then there'll be periods of time where they won't have as many symptoms and they'll feel better. Usually this affects predominantly women, and usually in their childbearing years, from about 20 to 45 are about the peak incidence of this. So take a look in your textbook. There's a couple figures and tables illustrating some of the various things with this disorder, because it is a pretty complex disorder since it affects so many systems in the body. Fibromyalgia is a chronic non-inflammatory pain syndrome. So this is typically classified by a person that has diffuse musculoskeletal pain in multiple areas. There's also other things associated with this. Many times sleep disturbances, fatigue, and depression are usually associated with this disorder as well. They're not totally sure what the exact cause is. However, they do believe that it's an abnormal response to pain in the neuroreceptors in the brain. So that's pretty much, so basically they have overactive pain receptors, and it's much more common in women than in men. So it's another thing to think about in your assessment with this disorder. Chronic fatigue syndrome. So this is a pretty disabling illness. The primary symptom that the individual is going to have is they will have severe fatigue that basically persists for 6 months or longer. Many times there's some other accompanying signs and symptoms with some other systems throughout the body. There's no known cause for this. Basically, and there's no diagnostic tests available, so that's another thing to kind of note. This is basically a diagnosis of exclusion. So this is one of those conditions where they can't diagnose it based on the results of a test, but what they do is they basically rule out other diseases. So this one will be really important with the differential diagnoses in the book, to look at that and see what other conditions they kind of look to rule out when they're going to diagnose chronic fatigue syndrome. Okay, so that's kind of takes us now into some issues that affect the endocrine system, which is our hormones. So pay attention to, as you're going through the readings, and I'll make mention in here about some of the different hormones as they're associated with some of the different endocrine, or the organs of the endocrine system. So we'll start with pancreatitis. So acute pancreatitis is an inflammatory process of the pancreas. So basically the enzymes of the pancreas essentially go and attack itself. There are sometimes causes to this. So 40% of the causes are caused by blockage of the biliary tract by gallstone formation. 35% of the acute cases can be attributed to alcohol abuse. So many times, and usually those two situations tend to be gender dependent. So males tend to have the condition as a result of the alcohol abuse, whereas females tend to suffer more from the biliary tract obstruction, as we know that gallstones tend to be more common in females. So again, the pancreas, so also in addition to looking at some of the other signs and symptoms for this condition. Again, try to focus in on some of the functions of the pancreas, both what it does as far as digestion is concerned and the digestive tract, and also from what hormones it secretes. Okay, diabetes mellitus. Okay, so this is a disease of the body, either cannot produce or use insulin effectively. So there are two types of diabetes that we're primarily going to focus on, type 1 and type 2. So the risk for death among diabetics is nearly twice as much as non-diabetics. There's a lot of health concerns associated with diabetes and a lot of complications that the individuals can have. So here's just a table illustrating normal blood glucose levels. So these are the blood glucose levels that you should be thinking about as far as what would be normal. So after fasting for 8 hours, it should be somewhere between 60 and 80 milligrams per deciliter. 2 to 3 hours after eating, somewhere between 100 and 140, and then any random or unplanned, the individual should have a blood sugar of less than 126. So type 1 diabetes mellitus used to be called insulin-dependent diabetes mellitus, because this is a form of diabetes that the body cannot produce insulin. So, and the reason for this, basically the mechanism by which this happens, or the pathology, is that it's an autoimmune mediated destruction of the beta cells in the pancreas. So the beta cells are responsible for producing insulin, which insulin is the hormone that is used to kind of uptake the glucose in the blood into the cells of the body. There's some other causes that they do attribute potentially to this as well. So they think that maybe a viral infection could kind of set this off, toxins and other environmental mediated issues. So about 10% of the total number of cases of diabetes are associated with this, and it's usually, the onset of this typically happens when people are younger, so usually less than 20 years of age. Here they're just kind of showing people have to take regular blood glucose measurements for themselves. So you see here just the use of a blood sugar testing kit, where they basically just take a little blood sample from the tip of the finger, and it kind of gives them a reading on their blood sugar. So make sure to make note of the red flags for diabetes that are in the textbook, and some of the terminology associated with that, and also some of just the general testing that they tend to do when you're looking at diabetes. Type 2 diabetes mellitus, and this used to be called non-insulin dependent diabetes. This is the more common diabetes that you would see. This is usually diagnosed when individuals are a little older. This is now, what happens here is the individual will be able to produce insulin, but their body doesn't know how to use it. So it's a kind of a combination of either a resistance to insulin and an overall decrease in insulin production. So basically what happens is, and you do typically see this in individuals who are obese. So it happens in a heavier person, their body just can't, their body kind of desensitizes itself to their insulin use. And now it's not always caused by that, but it typically, that's what you normally see in sedentary adults who tend to be overweight, where their body just doesn't know how to use the insulin anymore. So they still are producing insulin, but their body doesn't use it properly. It's not getting used to, and there what happens is if they're not using the insulin appropriately, their blood sugar just basically rises, and they have trouble controlling it. So just some points about the diabetic athlete, and we're gonna work a little bit more. Your take-home case study for your group is based on a diabetic athlete, and there'll be some other discussions in class about that. So athletes with type 1 diabetes need to carry testing strips. They need to regularly monitor their blood sugar levels, particularly when they get closer to activity, because with the injecting of insulin, they could cause their blood sugar to drop and they could become hypoglycemic. So another important thing to note, obviously all the signs and symptoms and everything associated with this disorder is important to note, but pay particular attention to the differences in the signs and symptoms between when someone is hypo versus hyperglycemic. Many of your athletic wounds will need to be a little bit more diligently cared for, as sometimes individuals who are diabetics may have issues with wound healing, so that's important to note as well. So make sure they're carrying all their own supplies and everything at all times. Make sure that their blood sugar levels are monitored. Your book also has a little bit of a side note on something referred to as diabetes insipidus. Now, diabetes insipidus doesn't have anything to do with the blood sugar. What diabetes insipidus is a disorder where the individual does not produce antidiuretic hormone, which is the hormone responsible for monitoring body fluid levels. So basically, when the body produces antidiuretic hormone, you basically will urinate less and you'll hold on to more fluid. In an individual that has diabetes insipidus, that hormone's not getting produced, and what happens is the individual will develop excessive thirst and urination because their body is no longer basically holding on to the fluid that they ingest. So read a little bit about that. There is a sidebar on that in your book. So don't confuse diabetes insipidus with diabetes mellitus. So be able to differentiate between those two. Okay, so here is picture the thyroid gland, because we're going to be talking about some disorders of the thyroid. So you can see it pictured here, just inferior to the larynx, right in the anterior throat region. The thyroid gland is responsible for the production of a few hormones. The two primary ones that your textbook focuses on, thyroxine and triiodothyronine, both of those are what many people associate with the typical thyroid hormones, or T4 and T3. They're responsible for protein synthesis, increased oxygen consumption in the body. So they really help they're really commonly associated with energy levels a lot of times, and just your body's kind of overall metabolism. There's another hormone that the thyroid gland is responsible for producing. Your textbook doesn't talk about it, but I'm going to mention it here. It's called calcitonin, and that is used to decrease blood calcium levels. So as blood calcium levels start to rise to a certain point, calcitonin gets produced, and that helps to basically keep all of the bone calcium content to the bones and kind of bring down blood calcium levels when they start to get too high. The thyroid hormones, T3 and T4, are stimulated by what's called thyroid stimulating hormone. Thyroid stimulating hormone is produced by the pituitary gland. So the little endocrine gland at the base of the brain is responsible for that. So when the body needs to produce the thyroid hormones, T3 and T4, thyroid stimulating hormone gets produced from the pituitary gland. Here we see palpation of the thyroid gland. So if you want to palpate it for enlargement or any type of growths or nodules, tumors on the thyroid gland, you could do that. It also helps to slightly extend the neck a little bit, or hyperextend it, because that'll make it become a little bit more prominent as well. So one of the conditions associated with the thyroid gland is hyperthyroidism. So this is a hypermetabolic state caused by excessive production of the hormones. So like what you have with many of your issues related to the endocrine system is you have either excessive production of hormones or decreased production of the hormones. Here you have an excessive amount. It's an autoimmune disorder characterized by a toxic diffuse goiter or enlargement of the thyroid gland. So in these individuals, and there's pictures in your textbook showing this, where the thyroid gland is actually enlarged, and they call this, oftentimes it's called what's known as Graves' disease. So a lot of the signs and symptoms associated with this will be connected to basically a person's overall metabolism kind of being turned on quite a bit with this. They also do associate a familial predisposition to this disease as well. So we just talked about hyperthyroidism. Now we also have hypothyroidism. So this is a metabolic condition caused by a thyroid hormone deficiency. This is more prevalent in women and does have a tendency to increase in frequency with age. So many times, when not 95% of this is just classified as primary hypothyroidism. In other words, the origin actually involves the thyroid gland itself. So many times the cause of this is an inflammatory disorder of it, and gets referred to as what's called Hashimoto's thyroiditis. So that's one of the common presentations of this in individuals. So again, look at the signs and symptoms associated with this. If now you think about not enough thyroid hormone being produced, just kind of think about what that would essentially end up doing to the body. So that wraps up the discussion of the pathologies and some of their background information. Again, make some notes and highlights, particularly with some of the conditions, again, just to be able to differentiate the signs and symptoms and make some of the connections there.